I'm Simon Moore from the Nanaimo site. My title of my project is Are You Ready for an Office Code Blue? An online video to help prepare for office emergencies. The website is officeemergencies.ca. There is a problem in our family medicine offices. Office emergencies occur, they occur often, and in fact, many offices are not well prepared. In fact, the research shows this. The Chicago study showed that 62% of offices see an emergency every single week, and 95% of offices in an Australian study saw an emergency more than one in the last year. The median number of emergencies in those offices in that study was 8 per year. There's a whole host of research that supports this statement. So the objectives of this program description style project were, number one, to create an online video. I wanted to make a project with an impact that would stay behind and wouldn't get lost in a pile of paper somewhere. So I wanted it to be online and easily accessible. The second objective was to make it evidence-based. Not just what the script of the video is, but also how the video teaches. There are a lot of evidence-based things that can be incorporated so that you know that a CME, a continuing medical education project, is actually going to teach something. For example, there's a needs assessment, a commitment to change, multifaceted, and interaction with other people. And there's a need is obviously demonstrated, as I just discussed as well. One of the other research projects this year by resident Dr. Bennett Boutillier showed that there is a need for this in British Columbia today. The last thing I wanted to do was to evaluate this and to do a survey to find out whether or not this video actually makes a difference. So the description of the program is as follows. We started out by doing a literature review, and not only the literature review, but also we contacted each one of the regulatory authorities and found that there are 3 provinces only that have a policy of this. We reviewed the abstracts and proceeded to have the presentation jam, and then 38 research articles were found and were included into a video script. Now you remember I said a multifaceted project is most useful, and so that's why there was not just a video but also a website that had a lot of resources, information on it, and that website housed the online video as well as the survey. And we set it up in a way that only people who went to this website were able to see the video, and that way the survey was directly beneath, hopefully to increase the amount of respondents. We also publicized the project. We used a research project poster that was posted in various medical offices, and there were other medical blogs that posted this as well, including the department head here, British Columbia Medical Journal, and there was a brief mention of this in the Canadian Medical Association Journal as well. And it was recently posted this month in the Medical Post newspaper. We had 275 people complete the survey. I was quite surprised to find that they weren't all just residents. We had several family doctors fill this out as well. And they mostly were based in Canada, but there were people from around the world as well. And here's what the survey showed. With regards to the format of the video, the online format, 96.7% of people agreed that the technology is satisfactory. They liked the online format. And people found that it was effective, they found that it was convenient, and they also found, and this is where this project extrapolates to other research areas, is that physicians would take other online courses using this technology. With regards to what was in the video, does this video actually help prepare people for office emergencies? The answer was yes. The topic is relevant according to 90% of people. Interestingly, when you do a subgroup analysis, some specialists find that it's not as relevant for them. Family doctors find it to be more relevant. 86% of people thought it increased their knowledge. Many people thought the video was well presented. You can decide for yourself when you see it shortly. And 90% of people think that this project will enhance patient care. There were 91 subjective comments as well, and I can only have the time to mention a couple of them, but most of them were strongly in supportive of the process. There were a couple that were not, out of 91. So in conclusion, we created an online video which was evidence-based in what it taught and how it was taught. The video evaluation said that the video itself was well presented and that it will enhance patient care. And finally, the online format was found to be convenient, satisfactory, and could be a future direction for future training and continuing medical education. I have a lot of people to thank, as well as all the actors, who some of whom are in the room right now, as well the UBC Family Medicine Residency and the BC College of Family Physicians provided funding for this project, and I'm greatly appreciative of them. And I've got no conflicts of interest to disclose. And I'll show the video now.
Would you be prepared if an emergency occurred in your medical office? Recent studies show that emergencies occur frequently, yet the offices of many physicians are not well prepared. The good news is, your office can improve. This video, part of a not-for-profit research project from the University of British Columbia, is designed to be viewed by anyone in your medical or dental office to learn about the required equipment and the necessary training to streamline your response to any office emergency. This video will show you 3 steps to improve emergency response, including preparation you can do in your office today. Step 1. Ensure your office has the right equipment. Currently, there is no widely accepted standard for mandatory resuscitation equipment for a physician's office, and only 2 provinces have published a list of mandatory equipment. As well, the Canadian Medical Protective Association is not mandated to provide such guidelines. However, guidelines have been published for family physicians, dentists, and pediatricians. These guidelines recommend that every office has the equipment listed here as a bare minimum. Note that recommended equipment does not include endotracheal intubation equipment. Like any skill, intubation should only be performed by practitioners who regularly perform it. In fact, in the pre-hospital setting, bag valve mask ventilation has been shown to be more rapid and more effective than endotracheal intubation, with no compromise in outcomes. Many physicians considered the cost of equipment to be prohibitive, yet a 2011 audit of Canadian prices showed that most basic resuscitation equipment can be obtained for less than $101. In addition, your office should also consider obtaining an automated external defibrillator. In an emergency, waiting for an ambulance to bring a defibrillator can be deadly. The benefit of defibrillation declines every minute a shock is delayed. Some offices will require additional equipment. Use an appraisal questionnaire to find out what equipment is recommended for your particular office type. Step 2. Streamline your response to emergencies to provide faster, more organized care. Organize the equipment in your office, improve response time and patient safety by creating individual medication boxes. Label each box clearly with each type of emergency, and include a clear list of medications and doses for adults and children. Additional tools can help streamline a response to an emergency. For example, a pylon can be placed outside of a room during a resuscitation to clearly identify where help is needed. Create a process so that equipment checks are routinely and thoroughly completed. For example, every Monday by the clinic nurse. Using a checklist can ensure the equipment is always ready for use. Post information at the reception desk to help staff recognize which patients require emergency care. Staff should be trained in how to activate an emergency response in your office, and should be encouraged to call a code blue even before fully assessing a patient. This helps practice the office emergency response, and is safest for the patient. A cue card can also help staff provide the information a 911 or emergency operator may request. Step 3 is to ensure everyone in your office is adequately trained. This list shows the most common emergencies encountered in adults and children. Make sure that everyone in your office is trained to use algorithms to manage these common scenarios. Each staff member should know what role they play in an emergency. In addition to training in the office, all staff should have some level of emergency certification, whether it be CPR with AED, ACLS, or PALS. Simulation is the best way to improve patient care in an emergency, and all published guidelines on this topic recommend the use of mock codes. Mock codes, especially when unannounced, have numerous benefits, shown here. Mock codes are important because simply distributing guidelines has not been shown to improve response to an office emergency. Practice is essential. Routine mock codes are inexpensive and take minimal time. Surveying your team before and after your practice session can reveal areas for further development. For example, when reviewing one mock code, a nurse noted that oxygen was not started even though an infant was turning blue, because the nurse did not have a doctor's order. In another case, an office staff member recognized that a patient was in severe distress, but did not call 911 because they thought the physician would want to make the call. Studies show that many offices failed to call 911 in an emergency. Reviewing mock codes can help prevent these errors when a real emergency occurs. In closing, here are some ways you can apply these 3 steps in your office today. Appraise your office. Download and complete an appraisal questionnaire to find out if your office is ready for an emergency. Share the results of your appraisal, along with this video, with the management at your clinic. Organize the equipment and medication in your office. Clearly label doses for adults and children, and develop a process to make sure the equipment is routinely checked. Post information at the reception desk about identifying emergencies and activating a response. Develop algorithms on managing common emergencies. Identify a staff member who can be responsible for setting up emergency training for all staff in your office. Using the steps outlined in this video, you and the team at your office can improve your response the next time an emergency occurs. You can find reference citations, more information, and resources available for download at our website. As well, if you would like to share this video with your colleagues, you can download a poster free of charge at officeemergencies.ca.